Well, not the shutdown, but federal cuts that could mean problems for Schuylkill Health. The system operates 2 hospitals in Pottsville, one of which receives most of its support from Medicare. As Matthew Petrillo tells us, funding for Medicare is on the chopping block, which could have significant consequences for the community.
Schuylkill Health manages 2 hospitals in Pottsville. There's the South Jackson Street Hospital, and just a mile away, the East Norwegian Street Hospital, the latter of which is designated as a Medicare-dependent hospital. That means it has less than 200 beds, is in a rural community, and 60% of its discharges are Medicare patients.
It is so important because most hospitals in the country don't have 60% of their patients of Medicare. They have much more commercial insurance to make up for the differences that occur from having that amount of Medicare patients.
But he says East Norwegian Street is poised to lose its Medicare-dependent hospital status, and with it, possibly $2.4 million.
By not having this additional incremental, it would be an immediate negative impact to our East Norwegian Street Hospital.
He also says the $2.4 million is just a droplet in the healthcare spending bucket. But he says cutting any of that will significantly impact area hospitals, especially in rural areas like Pottsville.
The challenge from a rural perspective is we get paid differently. We get paid less than our urban counterparts and academic medical centers. So it's a challenge. The same service of what a patient has done is paid less at a rural facility.
And then there are the patients who don't pay at all. Schuylkill Health has $14 million in bad debt or unpaid patient medical bills. But it's the potential loss of the $2.4 million that has officials at Schuylkill Health most worried. They're just not sure when or if the government will approve the funding at all. Matthew Petrillo, News 13, Pottsville.